study from the UK, which is usually a few weeks ahead of us here in the U.S., says people with Omicron are up to 70% less likely to need hospitalization. More evidence that Omicron, certainly more contagious, is apparently not as severe. And a Washington forecast, University of Washington, predicts that we may have a lot more new cases of Omicron when it peaks, 400,000 versus last winter's 250,000. But it also indicates fewer deaths than last year's peak. Still, it is the hospitalizations that have a lot of people worried, and that's where we begin tonight. Pleased to have Lydia Mobley with us, a traveling nurse who's just coming off that 13-week stint in Michigan, often working up to 80-hour weeks. Lydia, it's great to have you with us. Take us inside. What are you seeing on the front lines that you wish everyone could see?
Thank you so much for having me, Joe. Unfortunately, we are still seeing a lot of people who have chosen, for whatever reason, to believe social media or other sources that are not reputable and have chosen not to get vaccinated. And unfortunately, they are, as you said, I work in the ICU. They're using their last breaths to ask for the vaccine, and unfortunately, it's much too late.
What else are you hearing from them, Lydia? I was going to ask you that a little bit later, but since you brought it up, let's get to it now. What are these patients saying when they're either in the ICU or apparently facing what they believe to be their final days?
Again, most haven't come to the realization that this is it, but they just know that they're struggling to breathe. I just had a patient several weeks ago, and the hospital happened to be out of BiPAPs that night. A BiPAP is a mask that goes over your face and assists you in breathing, but is less invasive than a ventilator. Obviously, the ventilator is the last step. But he needed a BiPAP. The hospital that I was at was out because of the high number of COVID patients. And unfortunately, as he was struggling to breathe, he was asking me if it was too late for the vaccine. And unfortunately, I had to tell him yes. And that man died a week later.
I remember in the beginning, Lydia, where we were watching or seeing and hearing about people who were dying on Facebook, FaceTime, basically, with their families, with nurses like you holding the phone up so they could say goodbye to their families. Have we come a long way since then? And do you have hope for where we're headed right now?
Actually, some hospitals, the hospital I was just at was allowing visitors at end of life for COVID patients with a paper mask and a face shield. And so sometimes the family could be at the bedside if they chose to, but bear in mind that is an exposure, so then they would have to quarantine after. But not as many people dying alone, but unfortunately they are still dying. And I don't know about hope, because I thought from last winter seeing, we'd have 3 patients dead in just the first 4 hours of the shift. And this winter, it's like we're having more deaths, but the difference is these patients are younger. These are 20-year-olds, 30-year-olds, 40-year-olds who thought they didn't need to get vaccinated, who thought it wouldn't affect them. And unfortunately, that couldn't be further from the truth, because now they're dying.
Well, it does feel, Lydia, like we've gone back in some respects, despite the advances that we've made. And I think one of those things is last Christmas when we really didn't get together. And a lot of people now are questioning what to do as we head into the holidays. What would you suggest as people gather?
I think it's important to bear in mind that protection from COVID is a layered system, right? We have all these different layers. Obviously, the strongest is vaccination. And then there is the layer of masking. And now we're hearing more about rapid tests, but I would just urge people to view rapid tests with caution, because as the data shows, depending on the brand, and if you have no symptoms, they can be less than 50% accurate. So just because you get a negative rapid test doesn't mean that you should rush to go to a party or a gathering without a mask, especially if you're unvaccinated. I would say plan your gathering. And again, the best advice would be to limit to vaccinated people, but the best advice would be to limit or to plan your gathering around the most vulnerable in your group, to determine how many layers of protection you would need. But absolutely, everybody who's meeting should be vaccinated.
You have an interesting perspective on this, Lydia, because you've been a traveling nurse and you've seen a number of hospitals. Most of us have had some kind of break from this, right? Whether it's work from home or some different break. Can you give us an idea in your travels as a nurse, what kind of toll this has taken, not only on you, but the others you're running into on the front lines of healthcare workers?
I think healthcare workers across the board are just so burned out and so tired. And again, we have all of these very useful tools to stop this, but unfortunately, not enough people are stepping up and getting vaccinated. So I would urge those who want to thank healthcare heroes or, the true patriots of this country to please get vaccinated, because the American thing to do is to get vaccinated. That is how we will get out of this.
There are some in your own profession, though, Lydia, who are fighting the vaccine mandates for healthcare workers. Have you found that to be a problem? And is that a reason you're having to go to some of these areas because they're shorthanded?
Yes, that is one of the reasons that staff is short. I did, when vaccines were first introduced, I rushed to get mine. I was so happy that we finally had hope after watching all these people die. And I would say that there were some healthcare workers I came in contact with that were a little bit hesitant, but I think as they saw, that the vast majority of people don't have any effects from the vaccine, or they have, short-term, maybe 24-hour cold symptoms or a fever or something very minor, that I think that brought a lot of them around. Unfortunately, yes, there are still some who have resisted the mandates, and that's their personal choice, I guess. But also, I think patients have the right to come to hospital and not have to worry about being infected by those who are entrusted with caring for them.
I think people might have been surprised to find out about these traveling nurse positions that you have. What's the next stop for you? And do you have any final thoughts? What's ahead for the hospital systems, do you think, or do you fear in the weeks and months ahead?
I fear in Michigan, and my next contract will be in Michigan also. We have a particularly low vaccination rate, and compared to other states with low vaccination rate, it's very cold here, so people are gathering indoors. Michigan hospitals are already at the brink. And again, back to our vaccination rate is lower than Texas and Florida, which might surprise a lot of people. And we also have no mask mandate here. So I only foresee in the next couple of months that getting worse, unfortunately, in Michigan. And I worry about my loved ones who, perhaps need treatment for other things, because a lot of hospitals here in Michigan are canceling elective surgeries. And unfortunately, people who are living with pain, who need joint replacements and such, they won't be able to get them, which is very sad. But unfortunately, I think these next few months are going to be very dark for Michigan and perhaps the country.
Well, a phenomenal voice to start us off tonight from the front lines. Lydia Mobley, it's great to have you. Again, I appreciate, and I think I speak for all of us in saying thank you for all that you and the frontline healthcare workers are doing. Thanks for the time.
Thank you so much for having me, Joe.
You bet.
Thank you.
Best to you. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.